Gondola has no side effects. It's a programmed mechanical stimulation. If we move 3 millimeters from the contact point, it doesn't work. It's a difficult stimulation, years of research and trials, years to finally achieve the optimal result. We've reached that point for a few years now, but the early years were truly terrible. Then finally MRIs came along, which revealed the reason why the patient feels better. All of this, the medication doesn't do it, or it does it in a distorted way. It acts like setting off a bomb in the brain instead of, like us, targeting the right spots with precision like snipers. Magnetic resonance imaging has removed all doubt. Peripheral stimulation is able to activate the most important and most difficult areas of our peripheries, which serve to reactivate the primary and secondary motor areas. Does the patient experience benefits for 2 or 3 days or just 1 day? It depends on a number of other factors that often even we don't fully understand. What we do know, however, is that stimulation, once you apply it, improves motor activity and the brain does not develop a tolerance. The first images of Gondola in functional magnetic resonance imaging showed a typical Parkinson's patient inside the functional MRI, where you could see the entire scan, the whole outline of his brain and the affected areas. Outside the MRI, after undergoing therapy with Gondola, the patient was put back in exactly the same condition and you could see the reactivation of the motor areas that lit up. I think that was one of the most beautiful moments of my life. From there, I thought, imagined and hoped that researchers would gladly welcome this information and then build thousands of other activities starting from this perspective. Instead, there was absolute silence. Even today, people are convinced that by doing rehabilitation, because it doesn't hurt after all, patients can somehow improve their condition. Parkinson's disease is not a disease of the body. The fact that someone trembles, the fact that they walk poorly, it's not the body, it's the brain that's not working properly. Today, we have the ability to access the control center, and so if we manage to restore a control center with stimulation, the body gives us a response. When we talk about clinical work, we always refer to the tools that are made available, but also to data that is scientifically assessed and evaluated by third parties. All our clinical studies have shown that all patients treated, or rather the majority of these patients, experience significant improvement in gait, balance, and their ability to turn. The patients who initially received the sham stimulation as a placebo effect seemed to be slightly better, but soon after they returned exactly to how they were before. So, when conducting clinical studies, that's the only certainty we have, because before signing off on a clinical study, people are very careful, especially since we're talking about a medical device which comes with quite significant responsibilities. So I feel confident in saying that when there are certified medical devices like Gondola, with us we have 14, but we won't stop at 14 publications. It means that it's already a tool where the patient doesn't need to believe or not believe. It's the scientific literature that takes precedence.